Hello everyone, my name is Diala Samuel, and in this series of video I'm going to teach the pharmacology of the central nervous system, just to make it simpler and to help you understand it. Just by means of introduction, in this video I'm just going to introduce the central nervous system. Now, the nervous system as we know it is divided into two major parts, which is our central nervous system and our peripheral nervous system. Now, the peripheral nervous system is basically made up of peripheral nerves, while the central nervous system is basically made up of your brain and the spinal cord. The pharmacology or the drugs that affect the peripheral nervous system are more simplified or more simplistic because the peripheral nervous system contains just majorly two neurotransmitters, which is acetylcholine and norepinephrine. Now, what is a neurotransmitter? A neurotransmitter is like a chemical which allows nerves to communicate with each other. So, the neurotransmitter is produced at a location called a synapse, which we will discuss later, and it allows two nerves to communicate with each other. So, these neurotransmitters are just few found in the peripheral nervous system, and so the pharmacology is a bit simpler. Whereas in the central nervous system, the pharmacology is very much more complex because we have many neurotransmitters in the central nervous system, which include glutamate, GABA, which is short for gamma amino butyric acid. We have glycine, serotonin, dopamine, melatonin, and some others. And so because there are so many neurotransmitters, the pharmacology of the central nervous system is more vast, more complex. And also because there are so many receptors found in the central nervous system, the drugs that are going to be used to treat disorders found in the central nervous system would also be very vast. And it will also affect several other parts of the body. Like a drug that might be used to treat the brain problem can also act in the GIT, can also act in the kidneys and so on, because some of the receptors found in the central nervous system can also be found in other parts of the body. And so the central nervous system, or rather the drugs that affect the central nervous system, do cause a lot of side effects that may not be naturally associated with the central nervous system. Now, some of these neurotransmitters can be excitatory, which means that they cause excitatory postsynaptic potentials, while some of these neurotransmitters can be inhibitory, which means that they cause inhibitory postsynaptic potentials. But to explain what inhibitory postsynaptic potential and excitatory postsynaptic potential means, I'm going to use a schematic diagram to explain this. Now, this is what we call a synapse, which is just a point of connection between two nerves. Right? Some will say that this is a synaptic space. Now, the neuron before a synapse is known as the presynaptic neuron. Or it's called the sending neuron, which means that it is sending signals. While this neuron after the synapse is called the postsynaptic neuron. Or the receiving neuron, because it is receiving signals. Now, when neurotransmitters are produced by this presynaptic neuron, the question is, how are they produced? They are produced in the cell body. They are stored in vesicles. When they are stored in vesicles, they are transported along this axon. When they get to the axon terminal, they are secreted into the synaptic space. When they are secreted into the synaptic space, they have the ability to bind with receptors. So I'm going to use squares and triangles to represent receptors. So this is a receptor, this is a receptor, this is a receptor, another receptor, a receptor, this is a receptor, this is a receptor, this is another receptor. So from this you can see that when this neurotransmitter has been released into the synaptic space, it can bind with the receptor. So I'll use small circles to represent neurotransmitters. Now, if this neurotransmitter would cause an excitatory postsynaptic potential, it means that when it binds to the receptor, it has the ability to open up sodium channels. Now, when it opens up sodium channels, what does it do? Because sodium ions are larger outside the cell than inside the cell, when it opens up sodium channels, it will cause sodium ions to flow in through those channels into the nerve. And if sodium ions flow into the nerve, because they are positive, it will increase the positivity of the potential in that nerve. And we already know before now that increase in positivity increases the excitability of the nerve. Remember that a neuron has what's known as a resting membrane potential, which is the potential that the neuron has at rest. And that resting membrane potential is negative 70 millivolts, which is the normal potential of a neuron when it's not firing, when it's not transmitting any impulse. Now, if there is an influx of sodium ions into the cell, it means that the cell becomes more positive. So it can go higher to maybe negative 50 millivolts. Can go higher. And if it crosses the threshold, let's say it crosses negative 50, negative 50, let's assume that this is the threshold. If it crosses the threshold, then the neuron experiences what is known as an action potential, which is a rapid increase in the positivity inside the cell. So excitatory postsynaptic potentials, they increase the possibility of an action potential because they increase the positivity of the neuron. But when you have an inhibitory postsynaptic potential, it can do two different things. It can either open up potassium channels or open up chlorine channels. Now, when they open up chlorine channels, because chlorine is negative, when you open up chlorine channels, it means that chlorine begins to flow into the cell from outside. Why? Because chlorine ions are more outside the cell than inside the cell. Chlorine ions, which are negative, entering into the cell would increase the negativity of the cell and further reduce the potential further lower. So it was negative 70. When chlorine ions flow in, it might be about negative 100 millivolts, maybe down here. And you can see that it is farther from the threshold. And so the ability of this nerve to fire becomes reduced. It becomes difficult for this nerve to reach action potential. And that's why we call it hyperpolarization. So we say that this state at the cell is hyperpolarized. So inhibitory postsynaptic potential works with hyperpolarization. Or they can actually open up potassium channels. Now you ask yourself, potassium as an ion is positive. So how come potassium channels would cause hyperpolarization? The reason is because potassium is more inside the cell than outside the cell. So when these channels are opened, potassium ions will tend to flow outside the cell. Remember, diffusion occurs from a place of higher concentration to a place of lower concentration. Now, if potassium ions flow outside the cell, it means that the cell is losing its positivity and the cell is increasing in its negativity. So the cell is also hyperpolarized. Now, as you already know, when the cell becomes more negative, it's farther away from the threshold. And this would mean that the cell becomes more difficult to have an action potential. It becomes more difficult to fire the cell, and so we call it an inhibitory postsynaptic potential. What are examples of neurotransmitters that cause excitatory postsynaptic potential? And what are examples of neurotransmitters that can cause inhibitory postsynaptic potential? Examples of neurotransmitters that will cause excitatory postsynaptic potential are just two major ones. EPSPs. Example, your glutamate. Another example is acetylcholine. So we can see that these neurotransmitters tend to be excitatory in nature. What about neurotransmitters that would cause inhibitory postsynaptic potential? One of them is GABA, or gamma aminobutyric acid. Another one is glycine, and in some cases dopamine. Now you see, GABA, one of the most important functions of GABA is that it opens up chlorine channels. Glutamate and acetylcholine, they are more excitatory in nature. Now, one of the importance, or one of the things you need to know about a synapse is that many presynaptic neurons can synapse at one postsynaptic neuron. That means you can have 20 presynaptic neurons forming a synapse with just one postsynaptic neuron. And each of these presynaptic neurons will release their own neurotransmitter. So some can release excitatory postsynaptic potential like neurotransmitter, and some of them can release neurotransmitter that will cause inhibitory postsynaptic potential. So what determines the overall potential of the postsynaptic neuron is the summation of all the neurotransmitters that will cause excitation and all the neurotransmitters that will cause inhibition. In some cases, they will be equal, and so at the end, there will be no potential at all by the postsynaptic neuron. In some cases, the inhibitory postsynaptic potentials are far higher, so the overall effect in the postsynaptic neuron will become hyperpolarization. In some cases, there will be a lot of excitation, a lot of excitatory postsynaptic potential, and maybe a very high inhibitory postsynaptic potential. So at the end, there will be a more positive potential, but it may not be high enough to reach the threshold. So the cell may still not fire, or impulses may still not be able to pass. And in some other cases, the excitatory postsynaptic potential are way higher, and there is little or no inhibitory postsynaptic potential, and the overall effect would cause excitation, would cause an action potential. But pharmacological drugs that are used in pharmacology tend to be targeted towards either causing an excitation or an inhibition, depending on what they want. For example, drugs like anti-epileptic drugs, that's drugs that are against epilepsy, we tend to want to cause inhibitory postsynaptic potentials. Why? Because in epilepsy, you are having an overexcitation of nerves. So if there is more inhibitory postsynaptic potential, it will help to manage epilepsy. And so we can say that inhibitory postsynaptic potential help in reducing overexcitability of neurons. Inhibitory postsynaptic potential, they help in maintaining the balance between excitation and inhibition. And so most drugs would want to cause inhibition, and most other drugs would want to cause excitation. And this is just the basic introduction of CNS pharmacology. In the next video, I'm going to talk about neurodegenerative disease, especially Parkinson. And I so much enjoyed this because Parkinson's disease is one of the diseases that affected one of our popular boxers, Muhammad Ali. And so just tune into the next video. I did it and I taught it with a great deal of passion and enjoyment.